Greetings and welcome, everyone. Welcome to Moving from Crisis to Stabilization, the case for professionalizing the direct support workforce through credentialing. My name is John Raphael. I'm the Director of Educational Services at the National Alliance for Direct Support Professionals, and I have the honor and privilege to moderate and kind of host this webinar. In this webinar, we're going to drill down. We're going to drill down and discuss a paper that was released in February of 2019, and that was co-authored by experts from three organizations: the National Alliance for Direct Support Professionals, the Community Bridges Consulting Group, and the National Leadership Consortium on Developmental Disabilities at the University of Delaware. I'm going to introduce you to the authors in just a moment. But that paper is exploring and will explore in this discussion and this webinar will explore how a nationally recognized credential may help to stabilize the direct support workforce crisis that we are currently in and that we have been experiencing for many years. And all of you who are listening, I'm sure, are no strangers to the difficulty in not only obtaining direct support professionals, but retaining them. And the retention of direct support professionals is a huge problem in our system. This paper is going to explore how a credential can perhaps address some of those challenges and improve direct support as a profession, but ultimately help with providing better quality supports to people with disabilities in the United States. I would like to now introduce the three authors of this paper. And there they are on your screen, and I will just go from left to right. And first, Caitlin Bailey. She is with the National Leadership Consortium on Developmental Disabilities at the University of Delaware. Second, Drew Smith is a partner in the Community Bridges Consulting Group. And lastly, but certainly not least, Joseph Macbeth, the Executive Director at the National Alliance for Direct Support Professionals. These were the three authors who, in my opinion, and especially as they begin this discussion, they have a compelling case. And that compelling case for credentialing is what this next hour is going to be about. So without further ado, one more thing. We have a bunch of questions that are going to be on the screen, and these questions are going to guide a conversation, and that's exactly what this is. I'm going to moderate a conversation between these three leaders and these three authors. So with these following remarks, you're going to kind of hear what their ideas are about how we can make this workforce more stabilized. This webinar will be recorded, and it will be also put on the NADSP website, and probably a few other avenues for you to watch it again during a rebroadcast, or you can watch it on your own. And the paper that is in discussion will also be made available, and actually is available on the NADSP.org website. We'll get to that stuff at the very end too, to give you again some resources how to get this material. So without further ado, here we go. I would like to ask a question to the three panelists, and you jump in as you all see fit. I will try to moderate you as best I can, but you are all three very engaging conversationalists, so wish me luck. Why did you write this paper? And whoever would like to jump out first, please have at it. And just state your name before we start. Go.
Well, John, hi, thank you. And this is Joe Macbeth. I'm going to take the first stab at this question. I'd like to welcome everybody to this webinar. We wrote this paper because this paper needed to be written. We've been talking about the challenges in stabilizing this critical workforce personally for 20 years, and others have been doing it longer than I have. There's a lot of discussion about how we can improve the recruitment and retention of the direct support worker. And there's a lot of ideas out there, and a lot of them are, let's focus on wage campaigns. And if we could only increase the wages for direct support professionals, then all of our problems will be solved. And I disagree with that. I think this is such a complex issue that we need a variety of potential solutions to address the workforce. Credentialing, while may not be for every direct support professional out there, could be very effective for your more tenured direct support professionals and those DSPs who are working in this as a career. It's an opportunity for those direct support professionals to demonstrate what they've learned on the job and integrate that with their practices. And that demonstration would, like any other credential, would be objectively evaluated and recognized for the good work that they're doing. The NADSP has had a credential for 10 years, 12 years now, and we know firsthand through this evidence of these work samples and DSPs talking about their work improves lives. There's no question about that. It improves outcomes for people. And DSPs, direct support professionals, who have historically been regarded as an entry-level job, a low-skilled job, are finally showing the high level of skill that's required to be an effective practitioner. And using the intention that they've learned through a training program that has been accredited, a training program that is current and contemporary and uses values-based types of trainings, taking that knowledge and practicing it on the job and having that work evaluated is something that this field needs to embrace. We often talk about the professionalism of this workforce. I would argue that you cannot professionalize a workforce without a credential. And I strongly believe that a credential needs to be based on universal skill standards, a universal standard type of practice where it is portable and recognized across borders, across state borders, across county borders, and it will only help not only the people that are being supported by a highly trained and highly skilled worker, but it would help recognize that DSP for the work that they do, and employers would be able to hire direct support professionals with full confidence, knowing that this potential direct support professional comes to you with a nationally recognized, standardized credential in direct support practices. Now, this isn't going to solve all of the issues, but I will guarantee you this is a quality enhancement type of approach, and this is really going to help those DSPs who may be having their salaries compressed because increases in minimum wage, starting wage increases, and those DSPs who've been around a long time are seeing people who have been hired recently making almost as much as them. Well, I think we should invest in the people who have been around a long time. And I think that we should provide opportunities to really create a career ladder so we don't have to promote these great direct support professionals into a different job in order to pay them more. And from my perspective, this paper needed to be written for a long time. And it's a very comprehensive paper, and I hope you all have read it. And I know my friends and colleagues, Drew and Caitlin, have more to add to that. So that is my response initially.
Yeah, and thanks, Joe, and hi, everyone, and thanks, NADSP, for hosting this. This is Drew. Yeah, I would just add to that, and I think, Joe, you hit a really key point. You know, this is a paper that probably should have been written 15 years ago. You know, Amy Hewitt has a great saying that the issues in the DSP workforce today, it's no longer really a crisis. It's a systemic failure. And, you know, as we were thinking about this paper, I think we really tried to think of, you know, how does a systemic failure come to be? And it really comes to be over a long period of time, over compounding issues. And so, you know, as we started to frame out this idea, we kind of looked back and thought, you know, really how long has this issue been an issue? And I think, we all came to this consensus where you look back to the days of large congregate settings for IDD services, state-run institutions. Recruiting and retaining DSPs back in those days in the 80s when, the vast majority of services were provided in those large settings was a challenge, right? I mean, it's not something that's new, and it's continued to compound over the last, 30, 35 years as the service system has grown exponentially, as the types of services and how services are providing have changed significantly. And so this issue has really become compounded. And what we're seeing now, and we continue to call this a crisis, but I think Amy's right, this is a systemic failure, is if we don't do something to stabilize the workforce and stop putting band-aids on trying to fix the workforce and really say, how do we dig our heels in, really look at the professionalism of this workforce and really look at how we grow this into a real meaningful career, we've got to do that now. If we don't, then, we face the issues of returning to those days of larger congregate settings because we don't have adequate workforce to support people in more integrated settings within the community. And so, if we're going to really say that we value the relationship of, supporting individuals to live the lives that are important to them, to meet the quality indicators that are important to them in their lives, then we really have to look at what is that linchpin to those outcomes. And I would argue wholeheartedly that that linchpin is the direct support workforce. And if we fail to really dig our heels in and say, how do we solve the problem, then I think we do a disservice to the individuals receiving services. And as you said, Joe, this isn't the silver bullet. This issue is complex. I mean, how we got here, the years of work in advocacy and changes in policy and ebbs and flows in public financing have all built to this point. But I think we're at a tipping point now where if we don't make a change is going to be forced upon us. And we know that, it's better to be proactive than reactive. And so I think this paper is really looking at how do we be proactive about supporting a workforce who plays such a critical role in supporting individuals with disabilities.
Yeah, and if I could add one more thing, and I think we all know that the job of a direct support professional is changing. It's evolving. We expect more from direct support professionals today because they're often working without a line of supervision. They're often asked to use their own judgment. They're asked to make good, sound decisions. It's time to raise the bar. I mean, we need to expect more of our direct support professionals, but we have to invest in them, in their training and development, and the way they do their job. And I think this paper really makes that case. So thank you.
Right. Caitlin, anything to add? Because I think the next question kind of goes to you, but anything in terms of why you wrote this paper?
No, I think that is a great summary of why we wrote this.
Great. So let's go right to, I think, a very important question, a very basic question. What is a credential or a certificate? What is this thing called a credential? And I think, Caitlin, you were going to respond.
I am, yeah. So for the purposes of clarity, we wanted to start by defining what we mean by credential and start with the definition that we used to write this paper. So we used a definition of credential that is a process by which a qualified agent grants formal recognition and status to people, agencies, or services that meet predetermined criteria. So when we're talking about a credential for DSPs, we're defining that by a process that will give formal recognition and status to direct support professionals who demonstrate the skills and the competencies that meet a predetermined set of standards. And we made some recommendations as to what those standards were. We also thought it was really important to differentiate what a credential was, or a credential or certificate was, from training. Because in our field, we have relied heavily on training DSPs as a means to assure quality services and a means to essentially define quality services. But what we know that credentialing does is that it elevates that training that DSPs are receiving by requiring them to demonstrate that the learning that they have gained in that training is stuck. So it requires DSPs to demonstrate that they really do have the skills that they need to provide quality services to people with intellectual and developmental disabilities, which is really useful for agencies and also for DSPs who will now get credit, like Joe said, for having competencies. We can think about this, for instance, if I'm looking for mental health services for myself or for a family member, I'm going to go to a credentialed or a licensed therapist or social worker, because going to that person means that they have demonstrated that they have the skills needed to really and truly support me or my family member, and I wouldn't leave something like that to chance. And I think that that's what we're thinking about when we're talking about credentialing DSPs. We also know that nationally, more industries are looking towards a credential to assure that workers can consistently demonstrate skills and competencies that are needed to be successful for their work. And this is happening across industries, and our field, like both Drew and Joe have said, is kind of catching up in that. And this is happening in part because industries are adapting to research that's showing that people are consistently entering the workforce not ready to work. So they're looking towards credentials to assure that the people that are working in their industries are gaining the skills in a way that's consistent with the industry standards and assures the services and products are delivered in a quality way. So what we know is that credentials have the potential to elevate quality across an industry. And John, I think that leads perfectly into the next question that maybe you have, unless Joe and Drew, you want to add to that.
I do, and I'm probably going to add on every question. I think one of the things that we really need to be clear about, that a credentialing program is not a training program. A credentialing program integrates that training and the skills and reviews how that is being pursued on the job. And we really want to see DSPs use a more standardized approach. The research of direct support practice is those skill standards. And any credentialing program is the foundation of any credentialing program is based on a valid set of skill standards. Mm-hmm. And that's what this is all about.
And I think that's a perfect segue into this next question. I'm sorry, Drew, but I think you're going right into this next question. So what could a credential for direct support professionals mean for intellectual disability, developmental disability services in the United States?
So I can start with this and then you guys can jump in. So for long-term supports and services, the nationally established credentials would, like I said, it would elevate the quality of services ultimately offered to people with disabilities. And it can do that by ensuring that DSPs are implementing what they learn in training, like we've talked about, and the services that they provide for people with disabilities. And we offered in the paper a tiered way of looking at, or a tiered or layered competency approach to looking at that way of assuring that DSPs have the skills and competencies that they need to demonstrate to be really successful in their roles. So a tiered or layered competency approach will support DSPs to show their skills at different levels throughout their career, which could provide true path to career laddering and to career latticing, we think.
Yeah, and what I would just add to that is, I think, and Caitlin, I think you said it well. I mean, typically we rely very heavily on training to be, that stamp that says someone has the adequate skill set to move forward. And I think that's true. But typically when we do training, we're then doing testing on kind of that short-term comprehension of the information that was just learned. I think the difference in credentialing and the value of credentialing, especially in the direct support workforce, is really looking at how do we move from that process function of, the process of providing training into showing how that training is really being implemented into practice. And I think that's what a credential really allows for us to say that, a DSP, given a plethora of different scenarios, is able to show how they're able to take that comprehensive competency-based training and really implement it into the work that they do. I don't think that we get to that with typical testing after training. I think what we need is that next step to say, yes, the training has a very strong value into developing that base skill set, but do we now have the right mechanisms in place where DSPs are taking that training and really putting it into place? And I think without that, we're to some extent flying blind on, the impact of that DSP relationship with quality, because we just don't really know if there is some causation between that training and the outcomes that people are responding to, are realizing in their lives.
Yes, and I have to add something, right? I look at this as, what could a credential for direct support professionals mean to them? I mean, I think it will finally distinguish a direct support professional apart from a caregiver, apart from somebody who's providing custodial care. And my goodness, direct support professionals have been seen as that caregiver for so long. And if anybody's done direct support work, that there's some caregiving, of course, especially if you're supporting people with physical disabilities, but it's so much more. And look at the skill standards. I mean, it is such a complex job. It's as Amy Hewitt would say, it is a multidisciplinary job. So it will give direct support professionals a professional identity. And we know that every organization that's providing direct support services in this country is having issues and challenges in finding and keeping good direct support professionals. Because we don't have a career ladder is one of those reasons. And of course, there's other reasons. But this is not going to be easy. And John, you talk about this often. You look at what social workers and registered nurses were 100 and 120 years ago. They were not seen as professionals either. They were caregivers, or they were friendly visitors. But through the course of time, and as they created their own credentials, everybody considers a nurse and a social worker a professional today. And if our rhetoric in this field truly means something about professionalizing the direct support professional, we have to do a credential. Yeah. Otherwise, our rhetoric is empty.
Yeah. I would just add, one last example to that, Joe, and I always try to frame this in my mind of, we're really good at looking inside of our industry about how do we look outside of our industry to see the value of credentialing as well. And, the adage I come back to, and, part of this is I'm biased because my father-in-law was an electrician, but, if I think about wanting to have an electrician come do work at my house, then part of what I'm looking for is that approval through some other body that they have been licensed and credentialed to show that they know that what they're doing and they're meeting a certain set of core standards. And it's not to say that someone who's licensed or who's not licensed couldn't do that, but I know that by showing that, they've proved that they have that ability to really take what they've learned and put it into practice in a way that makes me feel more confident in the types of services they're providing to me. And I think if we look at this across the lives of individuals with intellectual and developmental disabilities and families, I think that's a really important factor, is knowing that, I'm entrusting that you are going to help support me in the life that I want. Show me that you too have been supported to help in that support process.
Yeah. Excellent. Move on to this next.
When we're talking, when we're talking about the impact that a credential will have on the field, I think it's important to say that we're also talking about the impact that a national credential would have on the field as well. The idea is that offering a nationally accepted credential would enhance the portability for DSPs and define standards that would apply across states and across organizations. Like both Joe and Drew have said, the idea of a credential isn't new in our field, and we know that that it's been considered at the organizational and the state level, but we also think that a consistent standard that would be held across states and across agencies would actually be really good for our field in general. It would be good for systems. It would be good for states, because you would know that DSPs that are coming into your system with a credential would have the skills that they need to provide good services. This is also true for agencies unfortunately, we're in a time when turnover is so high in our field. When DSPs are onboarding, if they come with a credential, then agencies can be aware that they're coming with a consistent set of skills and standards that will be useful within their agency, and ultimately it will be really good for people with disabilities who will know that the people that are supporting them have the skills that they need to be able to do so.
And I think to add to that, I think I'm really glad you brought that point up. I think to add to that, I mean, part of what this paper is around moving from crisis to stabilization. And I think one of the issues that we could face by developing state-specific or, such narrow views of a credential is that it doesn't really help stabilize the DSP workforce. It might help within the constructs of that state or within that point in time that the state needs that. But the challenge is if, something changes in the dynamic of a DSP family and they're forced to move to another state, then that credential loses its value.
Yeah.
And so if we really want to stabilize the workforce, we have to have mechanisms in which a DSP can transfer skills across state borders. And I think, to exactly what you said, Caitlin, the best way to do that is to do a national or a standardized approach to credentialing that when you walk, just an example from Kentucky into New York, then your DSP credential has the same degree of understanding and meaning in either location. Without that, you might choose to go into a different field because you're losing what you've already retained.
But man, you guys are hard to corral in. Geez, you thought leaders, you. Let's go to the next question because I think it's gonna spark even more in-depth association with this paper. What will the impact of a direct support professional credential look like? And I think you've started to go there, but I think go a little bit deeper with that question because it's a very important question.
Well, I'll start with this. And I know Joe and Caitlin and John, everyone will have something to add to them. I think as we started to think about, the purpose of this paper, I think, was to initially frame that, yes, we all acknowledge that there's an issue. But, beyond that, what could developing a solution really mean to the field? And so I think that's where that focus came. And I think that's really the heart of this paper. And that's really looking at these impacts. And so, in the paper, we pulled the data around, why do DSPs leave the job? And this isn't news to anybody who's on this call, but we know that the, top 5 reasons: inadequate pay, a lack of supervisory support or appreciation, insufficient training or guidance, difficulties or stress in the work, and a lack of advancement opportunities. Again, we're not writing home with this groundbreaking news. I mean, we all know that this is typically what is causing people to leave, and that's not unique to our industry, but I think we see it in very large numbers, especially related to the difficulties and the stress of performing the work. And so, as we thought about those 5 different reasons, we said, well, what impacts those? So, if we think of those as kind of symptoms of the workforce challenges, then what are the symptoms of the symptoms? What's really driving that? And we kind of broke it into 3 primary areas that are most impacted by these 5 drivers. And in the paper, we lay out of course, reimbursement rates and DSP pay are a significant issue. DSP tenure, that constant churn in the workforce evokes a lot of challenges. And we know that impacts quality, that impacts organizational cost. And then also the impact of workforce churn on overall individualized outcomes for individuals with intellectual and developmental disabilities. And before we go into any of those specifically, I think what's important is, we outline those as 3 unique factors in this paper, but they're all interrelated. None of these are mutually exclusive. We know that DSP wages impact DSP turnover, wages and turnover impact quality, quality impacts tenure. So if a DSP is feeling like they are disenfranchised, then they're likely going to leave. So, the paper lays them out as unique components, but they are very intertwined with one another. And I think it's important as we were looking at this and looking at how do we develop a solution to help try to, solve some of these issues, we were very mindful of that interconnectedness. So with that, talk a little bit about rates. We'll go more in depth on the rate component and value-based payments later. But to start, one of the biggest challenges, I think, within the rate setting structure in IDD services, and for those who don't know, I started my career in assessment-informed resource allocation methodology, so I won't go into all the nuts and bolts of this. But we know one of the biggest drivers to reimbursement rates are staffing rates. And that looks at staffing ratios, that looks at DSP wages, that looks at things like vacation, sick leave, training, and all of those components. And really one of the biggest challenges I think we've had is, we've built a rate system without adequate access to data around this workforce. And what I mean by that is typically when direct support professional wages are developed into a rate structure, they use occupational codes collected by the Bureau of Labor and Statistics to identify similar or like jobs. And then they look at, what are the skills associated with that job, and then what is the rate of pay associated with that job. And unfortunately, and we'll talk about this more later, there's not an occupational classification or code for the direct support workforce. And so what we're doing is to some extent playing Dr. Frankenstein in this, and we're trying to put these components together to build what we think to be an adequate DSP wage. But we lack true data on ensuring that has the best match to skill set. We have really not adequate data on the size of this workforce or the true rate of pay. I think we're getting there. The NCI Staff Stability Survey is starting to chip away at that to better understand what are some of those impacts of turnover and what are DSP wages really looking like nationally. But we're kind of flying this blind. We don't really have a lot of good data to help support this. And so really what we've done is we've built rate systems around DSP wages that aren't pay for performance, but are really, and for lack of a better term, pay for a warm body. As Joe had mentioned, what happens typically when there's a rate increase, especially if we get a one-time legislative increase in rates to help support the DSP workforce, is you raise everybody up. And so those rate increases aren't impacted by skills, qualities, understanding of a unique DSP, or the abilities that they've gained through that process. It goes to everybody, and what that does is it interjects a sense of inadequacy for DSPs who have been in the job for a long time because they've developed the skill sets, but those rate increases are being handed out proportionately across the entire workforce. And so we have a system that really doesn't have good data to build those rates, and has a process of putting more money into the system that doesn't support better development of the direct support workforce. And so you almost disenfranchise the workforce as a whole, even as you put more money into it. Like I said, we'll talk more about, how might we fix some of that later, but we'll kind of move on to tenure now and the impacts of credentialing on tenure. And like I said, the NCI Staff Stability Survey has really done some groundbreaking work on better understanding on a national level the degree of turnover in the field. And while for individual organizations it's not shocking, I think as a field we look at this and we say this is a huge problem. I mean, yes, turnover is high in other industries, but we see something that is unsustainable. And what the data from NCI shows us is that as a DSP stays in the field, the longer they're in the field, the rate at which they proportionately leave the field goes down, right? And so similar to all of us, if we've committed to a career and to a field and we stay in that field past a certain period of time, we're more likely to stay in that field longer. The challenge that we face, and this is kind of going back to those 5 drivers for why DSPs leave, is that, it's a very complex, complicated set of work. And so if people come in not really understanding, or they feel disenfranchised through the amount that they're being paid or the hours or types of things they're being asked to do, then they're not likely to stay long enough to really make a big impact and reduce that ratio or that degree to which they leave. And part of that I think is looking at that data from Metascape that we put into the report, where it shows that almost 50% of DSPs say that they leave because of lack of support or appreciation, or a lack of advancement opportunities. And so, to Caitlin's point about a credential leading to career lattices or career ladders, what we need to be able to do is, in my opinion, is identify a way to support good DSPs to stay good DSPs. I think we have this catch-22 in this field of, we need to be able to promote DSPs and give career advancement, but that typically leads to promoting them out of the role of a DSP. And so what we're doing then is we're taking good DSPs out of their work so that they don't leave, but then we're putting in a void of not having that good DSP able to do their work. And so I think what credentialing allows for, through that tiered process of, in the paper we've outlined it as 3 tiers to a DSP credential, is you give now a process for DSPs to advance within the DSP field. And I think that's critical to keeping DSPs here, to keeping DSPs feeling engaged and appreciated within their jobs as well. And then, last and definitely probably the most important component of this is, how does DSP tenure increasing impact the quality of supports being provided? Because, if you were to ask any of us on this phone, why are you here? We probably all say, first and foremost, to make the lives of people with disabilities better, right? And we are just stewards in that process. We are just here to help support individuals to be more engaged in their communities, to develop friendships, to increase their ability to have choices and make life choices and thrive. And what we've seen in the data that we put in the report from the Council on Quality and Leadership, which I think is really groundbreaking data, is that if we invest in this workforce, there's a true impact on quality, right? So in the data, we show that organizations who are investing in ongoing staff development, there is a significant decrease in behavioral challenges for people. And that makes sense, right? This is common sense stuff. If I feel like there's more stability and that my staff are more able to help support me with my unique needs, then I'm much less likely to use quote unquote behaviors to show that I'm dissatisfied with the supports that I'm receiving. We know that continuity in the supports, the degree to which an individual is with the same direct support professional long term has a substantial impact on the amount of trust they have in a DSP and the ability to then talk to them more openly about critical life matters, instances of abuse and neglect, choices around their medical care. And so, what the data is showing us, again, not groundbreaking. I mean, this is stuff we all knew, but now we're having to apply to it, is that if we invest in this workforce, the impacts on the lives of the individuals they're supporting are significant. And with that, I'm going to take a pause, try to cover 3 big topics in a short amount of time, and so give Joe and Caitlin an opportunity to add to those.
The only thing that I would add is bring the impact of this and how it would impact that point of interaction between a staff person and the person that is being supported. And when you have, and we've seen it with our traditional credential, better documented outcomes, a more intentional workforce. The complex skills required to be an effective practitioner are illuminated, and the peace of mind that families and people who receive support will have, knowing that you have a skilled direct support professional walking side by side you. And I always come back to that point of interaction, and how can we improve that point of interaction, because that's really where quality happens, right?
Yeah. Caitlin, unless you have anything else, I think we need to go a little bit further because we're down about 20 minutes left.
Absolutely. Go ahead.
Because there's a lot to do here. Check this out. What are values-based payments, and how can they be used to support a national direct support professional credential? In 4,000 words or less, probably Drew.
All right, so high level, we'll get into the kind of the actual rate process in the next slide, but value-based payments have been really successful in acute care settings, and we're hearing a lot more about value-based payments in long-term services and supports. And in acute care, it works so well because if you think about it, let's talk about diabetes management. There's a very direct or causation between a provider and the changes in someone's hemoglobin A1C based off of the provider's recommendations for changes in medication management, for example, or exercise. And so that relationship works quite well. You can look at the patient outcomes, and then you can pay for the provider because you know that that causation is there. In long-term services and supports, that causation, while it's there, is a longer fuse, right? So when we look about outcomes for individuals with intellectual and developmental disabilities, of course there are quality of life outcomes tied to health, right, and indicators of best possible health and all those components. But typically when we're looking at the values and those key indicators of quality, we're looking at, the increase of an individual's ability to make choice, decision making, where they live, whom they live with, how they advocate for themselves. And so that's a process that is much longer and much more complex. And, if we think about it, those are all things that are important to us. And none of those things happen immediately based off of one conversation or one interaction with any other professional. There's something that's developed over time. And so what I think value-based payments means, and the role of credentialing and value-based payments in long-term services and supports really focuses on, it's important for us to always look at individual outcomes and that point in time of our individuals achieving the outcomes that are important to them. But as we think about it from a payments perspective, I believe what we need to be looking for is how do we ensure that provider agencies who are tasked with helping to support those outcomes have the resources that they need. And so when I think about this, value-based payments is not around that causation of those one-time interactions, but more about how do we help ensure that a provider agency has the resources needed to provide the best quality supports they're able to support an individual to achieve those quality outcomes. And so credentialing, I think, really is used to then bolster the DSP workforce to say, we're supporting the individual to the best that we can so they can achieve the outcomes that are important to them. Now, that doesn't mean that they're going to achieve those outcomes, because honestly, it might not be an outcome that they care about in that day or an outcome that they're going to work towards. But if we can then shift the value-based payments to, let's make sure that everything that we're able to do and to control for, we are supporting through value-based payments to bolster that provider network to ensure that the resources and the staffing is adequately there to support individuals. Probably more than 4,000 words, John, I'm sorry.
That's fine. Joe or Caitlin?
Oh, yeah.
Response?
Oh, I know Drew has his answer to this, and I have nothing to add to that because Drew's the master on this. So go ahead.
Great.
So let's talk about how this actually plays out then into rate. So, and I think what's important as we look at this rate conversation, I think, and we can probably go to the next slide, John, look at the graphic. I think what this example that we've put into the paper shows is a process in which credentialing and changes in reimbursement structures can work either under a traditional fee-for-service structure or under a managed care structure. And so on the left-hand side, we have the current process, right? This is the recruitment and hiring process of, you find a DSP, you recruit a DSP, you verify employment, you do baseline training, they're hired on as an initial grace period, and then they get this base pay rate that's built into kind of the static reimbursement structure that through the state Medicaid program. And, that is what it is. And, there is some flexibility within providers to be able to modify those rates, but the rates are set in a way that they're typically reviewed every 5 years. They're not really going to be modified with, an outstanding workforce or a DSP doing more. They just kind of are what they are. So in the paper, and for those of you who work within state government or whoever worked in rate setting projects, you know that this is a relatively simplistic view at just one component of kind of that complex rate methodology. But I think it's an important look. So what we're proposing in this process is, you still go through that initial process of verification of employment, baseline training, you hire a staff person after that initial grace period. But then there's that significant shift where we move into some form of a credentialing process. So showing the staff person showing how they're taking that baseline training and their understanding of their role and responsibilities and put that into practice. And in this example, we've used the eBatch Academy program that's been developed by the NADSP because, and this is my opinion, I believe that that structure has a lot of value to this discussion. And so we've looked at that of how do you then earn the credential, and then it really moves into how do you pay for it, right? And what we really wanted to highlight in this example was we have to think of a way to pay for this structure that makes it obtainable for DSPs, makes it relevant to agencies, but does not bog it down in administrative data collection and reporting. And so when I think about something that would be bogged down, that would be trying to track this on a DSP by DSP level, right? And trying to get enhanced reimbursement from the state for one DSP going through credentialing. That's a non-starter, at least in my experience. That's not going to really be something that states are going to have the ability to manage on their end. Providers don't want to manage and manage care organizations. That's going to become very cumbersome in their review process. So what we laid out is, what if we were to take a structure where you have your base payment? So in this example, we have $13 an hour for a DSP who's non-credentialed. And then look at it as an organization develops a percentage of their DSPs as credentialed DSPs, how do we then do an incentive-based payment for all DSPs based off of that? And so an incentive-based payment would be a payment back to the agency that they could then distribute to those credentialed DSPs. And so here what we look at is taking that $13 an hour. Once an agency hits 65% of their DSPs credentialed at a level 1, so the level 1 that we've identified in the paper, then it would be a 4% increase in their reimbursement rate for the staff, for staff rates. So that takes it from $13 an hour to $13.52 an hour. Now, if you look at this on a micro level, that 52 cents seems relatively marginal, but if you think about that across all service hours, that becomes real numbers. And I think that the benefit to the state or to a managed care organization or to a provider agency is this is really a structure that allows us to shift from we're just going to pay for warm bodies to we're going to pay for skill enhancement within DSPs, and we're going to pay for the value that we know is there through that third-party credentialing. And I think what this does is it provides a structure that has not previously been there. So there are a lot of really great advocacy campaigns right now around DSP wages. But typically what those advocacy campaigns are asking for is that one-time increase in legislative funding to bring up, those COLA wages for DSPs, but it's not really tied to anything, right? And I think that's where we're getting stuck with legislative advocacy is legislature saying, so you just want us to give you more money and you think that's going to help slow the turnover with DSPs, but how do we know that that money is really buying us something better? It's this whole adage of, we're asking legislators to go and leave a bag full of money on a stump in the middle of the forest, and if the money's gone, then the presumption is that good things have happened with it. I think what legislators are asking for now, and I think it's our obligation to help provide, is to show them how that additional funding is going to buy better things and what it's actually buying. And so using data to show back that, we've been able to achieve this many credentials. Based off of those credentials, we know that outcomes have increased by X percent. And so having some of that structure to show back that money that we're asking for is tied to a structure that is buying something better. And I think that's really what we're trying to get to with this graphic and trying to show that interaction and the importance of, that money is important, but it's also important for us to show what that money buys.
Yeah, and this is Joe. I think that when you take a look at, there's a lot of talk in managed care about the quality of the provider. And we all know that the quality of the provider is largely the quality of your direct support professionals, the quality of the people who are working day to day, moment to moment with people. And this process is going to potentially reward the high quality providers who are really showing good outcomes and good data. And yeah, I think the time has come. We have to do this.
Yeah.
So what needs to happen to make this credentialing a reality, panel? What needs to happen?
I think a whole lot. As we've said several times, This is not a new idea. And we've, over the course of 25, 30 years, come up with many short-term fixes to try to address this decades-old issue of maintaining a good workforce. I think there needs to be some buy-in. I think we need to have some real serious discussions about finally investing in a quality workforce. I think we need to get the funders in this involved in these conversations. I think we need to get the provider community involved in these discussions, and I really think we need to get direct support professionals more aware and more active in their own advocacy work in creating this profession. You know, direct support professionals are often invisible when it comes to this workforce challenge, and where are their voices? I mean, we know a lot of them. We interact with tens of thousands of direct support professionals a year, and they share their stories of how they're helping people. Well, you know what? We need to document that, and we need to make it very clear that great things are happening at that point of interaction from highly skilled workers who 50% of them are living in poverty. It's time. So we need to have really important conversations to make this happen, and and allocate resources to those direct support professionals who will not only be here tomorrow, but next year and the year after that.
And I would just add to that. I mean, I think I'd add one thing and then kind of enhance some of the stuff that you had been talking about, Joe. You know, and I mentioned it earlier in the conversation, and NADSP led an advocacy campaign around this that many of the folks who are on this phone have signed on to. There needs to be a pretty direct advocacy approach to developing a standard occupational classification for the DSP workforce. I mean, if estimates are correct, about 1.3 million workers in the workforce who we have very little to no data on. So, you know, as we look at making these changes, we need to better understand what the workforce is today, how the changes may impact the workforce, and how it may change the system, you know, systemically over the next 10 to 15 years so that we can do some projections. I really do think that we need to have a framework to better understand and collect data around the workforce. The other, and Joe, you were talking about this, is really that investment. You know, and I think investment for this is two prongs, right? The first prong is a financial investment. The second is human capital. So, you know, purchasing a credentialing program, investing in the reimbursement rate structure changes and value-based payments, that's financial investment, and that is critical to this, to all of this working. The other piece of it, though, is making sure that as Joe said, I think around that advocacy component, of how do we really have this not as a siloed discussion and credentialing as a niche approach, but really engaging in conversations with policymakers at both the Centers for Medicare and Medicaid Services, the Administration on Community Living, state leadership, senators and congressmen or congresspeople, into, you know, what does this change really mean? What is the impact? And how do we stop putting Band-Aids on this problem and really say it's time for us to fix it? And if you just click over to the next slide, Joe, you know, I think we tried to put in a lot of, you know, good components in this paper, but for me, what it all boils down to is this last couple of sentences in the paper that says, you know, investment in the direct support workforce is an investment in the lives of people with disabilities. What the system invests is an indication of the outcomes it expects to see. An investment in the workforce shows a commitment to service quality that directly impacts those supported. And that's what it all, I think, boils down to. You know, if we're serious about this, and, you know, this service system is not going away, the service system is not going to shrink over time, it's just going to grow. If we're really serious about stabilizing it and really focusing on how do we help promote better outcomes for people, we have to start at that linchpin in the service system of the direct support workforce. If we fail to do that, then we will be in this perpetual process of chasing our tail and trying to see if there's some way to stabilize this continuing crisis or systemic failure. And I think we just have to say, time to draw a line in the sand and let's start looking at solutions.
I agree, and I would only add that given a mechanism to incentivize through the rate setting model credentialing in community-based programs, I don't think there's many provider organizations who wouldn't support this. They want to provide the best supports and services to the people with disabilities. And the direct support professionals, however they may be somewhat intimidated by a credentialing program, but that's okay. They would also, once they get the hang of it, you're doing this work, you're supporting people using these competency areas, using this code of ethics, and you're doing it intentionally. If that rate setting methodology can be incentivized and providers have access to that, you will see a huge growth in credentialing for direct support professional, a huge support for credentialing direct support professional workforce. Without that, it's just going to be more of the same. We'll have pockets of credentialing all across the country, and it works in certain organizations and is recognized in that organization. But once that DSP leaves that organization, it has no value. It has to be universal. It has to be portable, and it has to be standardized using those same metrics. A lot of organizations have in-house type of career ladder programs, which are wonderful while you're working there. But once you leave there, and we know 45% of the direct support professionals leave their jobs every year, many of whom are going to work in another job as a direct support professional. Well, geez, take that with you. So yes, we have to invest in the workforce, and we have to really identify this as the critical linchpin quality. And we've been saying that for a really, really long time. So that's all I have. John?
Well, I think between the three of you, our heads are spinning with really great information. And we appreciate your time and investment in this paper, and certainly in this hour-long webinar. But we are at kind of the end of our time now. But please, the conversation can still go on. And if you do have any questions specific to you, your state, or your organization, or any kind of questions at all, there's an address there that you can send any and all questions to. It's info@nadsp.org. That's info, I-N-F-O, at nadsp.org. Also, you can find this paper called Moving from Crisis to Stabilization on the nadsp.org website. It's very easily found if you just log on to our website. With that in mind, I'd like to say thank you once again to Caitlin Bailey, to Drew Smith, and to Joseph Macbeth for providing I think some hope in this quote unquote time of crisis in our workforce, and I think the ideas that you shared, I think, can serve us all very well if we try to implement them. So thank the three of you very much. Here's some more information from the three organizations that co-authored this paper, and I'll leave that up there for a few seconds. Once again, this webinar is recorded. It's being recorded. It will be available at the nadsp.org website for you to watch again, and as well as that paper is available. So thank you all for listening and watching, and we wish you well, and have a very good day. Thank you very much.
Thank you, John.
Thanks, John.
Thank you, John.